actually a third generation GLP-1 agonist. They are now have in the approval process fifth generation drugs like retatrutide, for example. Every time they do a new generation of drugs, they purposefully turn down the negatives and turn up the positives. So I think a lot of people, when you get something like Ozempic comes out and people are like, well, it's got downsides, they're completely correct. Holy crap, does it have downsides? But some people want to write off the whole thing. It's like, yep, none of this is all nonsense. You got to diet and exercise. And diet and exercise, of course, is amazing. But with further developments, you really start to crank down on the negatives. So for example, today, and this is much more up your alley than mine, but I don't even know what generation of blood pressure drugs we're on. It's got to be like 8th or 9th gen by this point.
I mean, it depends which one specifically.
For sure, but just in terms of like when did they make the first blood pressure drugs?
Well, we have like the JNC 8 guidelines that we use for blood pressure management, so it's the 8th generation.
There you go.
Yeah,
I guess correctly. So a lot of these drugs, if you talk about like side effects and risk